So there are some very clear advantages to blood-based biomarkers in comparison to imaging modalities. And just to name a few, they are cheaper, they are less uncomfortable if you don't like to be in an MRI tube, or if you're claustrophobic, or if you don't have an hour. They can be repeated much more frequently based on the fact that they're cheaper and they require less equipment and comfort. And maybe from a biological perspective, they have the great advantage of capturing biology. So as opposed to most imaging modalities that look at structural changes, the molecular biomarkers are capturing dysregulated pathways and various kinds of components that may be contributing to finally getting a structural change. So for that reason, and there's good data suggesting that their abnormalities may actually precede the detection of frank changes on structural brain imaging. Now there's a small caveat, despite the fact that I said we don't need imaging, we just can do blood-based biomarkers for the sake of argument yesterday. I have to add that PET scans, which are also an imaging modality, in combination with blood-based biomarkers, can be very powerful, because PET scans that are also capturing various kinds of molecular aspects of brain degeneration give you the biological component more limited, because it's usually one thing that you're actually detecting, but also the localization. Given that I just provided an argument for imaging, I want to add that blood-based biomarkers can capture tens, hundreds, thousands of molecules. So for discovery science, they can be a really powerful starting tool. And ultimately, as we advance in our understanding of what are the blood-based biomarkers that can have the highest predictive value, they also provide cheap, scalable, highly informative from a biological perspective biomarkers that allow us to capture multiple different aspects of the aging brain and vulnerable brain to degeneration. So the debate was organized by the Vascular Professional Interest Area group. And I think vascular is really one of the next frontiers of biomarker development. At the moment, we are using things like FLAIR or signal abnormalities and various kinds of structural imaging. And those are really heterogeneous in their underpinning cause and etiology. And the molecular biomarkers that we and others have published on tell us what are the different components of blood vessel abnormalities that may be contributing to the vascular component of brain degeneration. And why that's really important is that fundamentally, as the brain ages, the vasculature ages, and maybe even earlier than the other brain cells. So this is my scientific bias perhaps, and why I study vascular disease. I think that the vascular changes of the brain are part of that age-associated risk. Why aging is such a big risk factor for dementia may be in part explained by how blood vessels change with age. And some of the publications that we already have put out there and others coming out are capturing various kinds of molecular aspects of that and taking steps towards developing panels of biomarkers that allow us to capture the vascular component. One thing to note with regards to the vascular component is that it's not going to be as simple as a p-tau or a TDP-43 cryptic peptide biomarker, because we're capturing pathways or more complex aspects of blood vessel change. And it's not a proteinopathy where you just can go for a biomarker that's capturing that proteinopathy. There are multiple calibers of blood vessels, there are arteries and there are veins and capillaries, and so it's going to, I think, definitely end up with a panel as opposed to just one biomarker. This was an obstacle initially when biomarkers started being developed, but now that we have technologies that allow us to measure multiple molecular markers at once with really high accuracy, we have the chance of developing these biomarker panels that capture things like vascular abnormalities. Other diseases, other kinds of processes are like metabolic abnormalities that are as complex as vascular.